With only 4 radiation oncologists and 6 medical oncologists, the country is faced with the huge task of controlling and managing one of its biggest challenges in the healthcare system, as the rising numbers of cancer patients outgrows medical practitioners specializing in the disease. In Kenya, only 2 public health facilities offer holistic cancer treatment: the Moi Teaching and Referral Hospital in Eldoret and Kenyatta National Hospital in Nairobi. And at Kenyatta, they have to cater for over 100 patients a day despite the limited resources.
2% of the population by next year will be afflicted with cancer, and 2% of 40 million, that's 800,000. Where are we going to treat these people with this kind of facilities? This is only 5 public facilities that we have. We have 3 other, they have 2 private facilities and 1 private facility coming up. Most of our Kenyans cannot afford that.
According to Dr. Nyongesa, an oncologist at Kenyatta National Hospital, the high cost of treatment of cancer is quite prohibitive to many Kenyans seeking treatment, and many often succumb to the disease.
We may consider now going to second line, and the second line drugs are expensive. Yeah. And cost you around we have patients with us to look for 50,000 a month, you know, and the minimum you can get is 6 times. So 50,000 a month, 6 times, yeah.
According to her, early detection through self-examination is always better, as the ailment is cheaper and easier to manage in its early stages. The human papilloma virus HPV vaccine, which is accessible in Kenya and which protects girls from cervical cancer, is one example of preventive measures. However, taking food rich in fiber, foods with less cholesterol, and exercising regularly, avoiding smoking and high alcohol intake could greatly reduce the risk of getting certain types of cancer. Though the government, through the Ministry of Medical Services, is taking steps in improving cancer management in the country, many who have been directly affected say the country still lags miles behind as compared to her more developed counterparts. Raymond Ndolo, whose mother was diagnosed with Hodgkin's lymphoma and was fortunate enough to seek treatment in India, says a lot is lacking.
The hospital we went to, which is also public, it's also a public hospital in India. The facilities are miles ahead. They have the latest state-of-the-art, equipment. And for instance, all the locals, let's say the citizens of that country, are basically treated for next to free. But for us in Kenya, it is impossible to, for us to walk into a place like Kenyatta and even afford, say, a simple, chemotherapy.
According to Raymond, proper policy and more sensitization, especially at the grassroots, could do more to empower the common mwananchi.
The government, through the Ministry of Health, can just be able to, create more awareness. And first of all, make people understand what cancer is. And after that, we need to be opened up to all the available options of treatment. For those who can be able to afford to get, something a little better, you can try some of these countries out there.
October being a Cancer Awareness Month, some hospitals in the country, like the Mater Hospital, will be offering free prostate cancer examination on November 5th, while Nairobi Women's Hospital